Hi everyone, welcome back to my channel. This is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss hernias. So we are going to look at the risk factors, the symptoms, the diagnosis, the management, as well as the prevention strategies. If you are new or you haven't liked, please do like, share and subscribe. So what is a hernia? A hernia occurs when an internal organ or tissue pushes through a weak spot in the surrounding muscle or connective tissue. And most hernias develop in the abdominal wall, but they can occur in various parts of the body. So what are the various types of hernias? So we have many different types. The first one I'll look at is the inguinal hernia, which occurs in the groin, and it's more common in men. It's indirectly, there are mainly two types of inguinal hernias. We can have indirect as well as direct. So the indirect inguinal hernia mostly is congenital. It can be due to failure of closure of the processus vaginalis. And for the direct one, mostly it's acquired due to weakness of the abdominal wall muscles. So that's about the inguinal hernia. And then we have the femoral hernias, where they occur below the inguinal ligament, and it's more common in women because of higher risk of, and they cause higher risk of strangulation. We also have umbilical hernia, which occurs around the belly button, and it's common in infants, obese adults, and pregnant women. We have epigastric hernia, which occurs in the upper abdomen between the umbilicus and the sternum. We have the incisional hernia, which occurs at the site of previous surgical incision. We have the hiatal hernia, which occurs when the stomach pushes through the diaphragm into the chest cavity. Those are just some of the hernia types we have. And what are the causes and risk factors? So the causes can be congenital weakness in the abdominal wall. It can be due to increased intra-abdominal pressure, mainly from different things, such as in those people who have a chronic cough, for instance, if they have COPD or they are chronic smokers. We can also have increased intra-abdominal wall pressure from heavy lifting, constipation and straining, obesity, pregnancy and ascites. And also some of the risk factors and causes can include things such as previous abdominal surgery, in this case especially for incisional hernia. We can also have family history of hernias, as well as age. Mostly there is weakening as you age with time. So what are the clinical features or the signs and symptoms? So mostly hernias can occur as a swelling or bulge at the hernia site, more often visible when standing or straining. There can be pain or discomfort, especially when lifting, bending or coughing. We can have, for reducible hernias, there can be lumps that can be pushed back into the abdomen. And irreducible hernias, you can have lumps that cannot be pushed. So that's like a distinguishing factor between reducible hernias and irreducible hernias in terms of the lump appearance. So mostly hernias can also cause complications such as incarceration, obstruction, where there is abdominal pain, vomiting, constipation, distension. Can also have strangulation, where the blood supply to trapped bowel or tissue is cut off, thereby leading to ischemia, necrosis or peritonitis. And this is mostly a surgical emergency. So how do you diagnose it? So mostly you take the history and physical exam. Maybe this patient will come in with complaints of a chronic cough. You can also carry out investigations such as an ultrasound, CT or MRI, especially when diagnosis is uncertain for complex hernias, and also an endoscopy, especially for hiatal hernia. So how do you manage it? So you can divide it into conservative management and the definitive management. So for conservative management, this is where you observe watchful waiting, especially if the hernia is very small and it's asymptomatic. Yeah, and then for definitive management, this is the one that will mainly involve surgery. So there are different modes of surgery that can be performed. You can have an open hernia repair, where there are things such as hernioplasty. Yeah, you can also carry out laparoscopic hernia repair. Yeah, things like that. And how do you prevent it? So you maintain healthy weight, you avoid chronic constipation and straining, and you quit smoking. Remember, we said that things such as chronic smoking can lead to a chronic cough, so you cut on smoking, use proper lifting techniques, strengthen abdominal muscles gradually, and you treat chronic cough or lung diseases early. Yeah, so that's just a brief discussion on hernia. See you in the next video. Thank you.